Assalamualaikum doctors. In this video I am discussing about bronchial asthma history. How can we take? So the chief complaints come in exam like there are three scenarios I am telling. Number one, child 6 years with cough and shortness of breath. So 6-year-old child, this is the first we have to diagnosis from the features. Then viral induced wheeze, we know that preschool children it features like bronchial asthma. Another is asthma with Addisonian crisis due to sudden stoppage of steroid treatment. So maybe the child is diagnosed case of asthma here and Addisonian crisis, that is maybe fainted, vomiting, diarrhea, something, and child sudden stoppage steroid treatment we find on the history. In addition, disease features we know that there is pigmentation present on the body, salt craving, fainted, so much fatigue feeling. So these are the features present. So how can we take the asthma history? First, the features started together or one by one. Onset, course and durations, what make it better and what make it worse. Then how it started. Is he turned blue? Is it more at night or the same all over the day? Describe for me his cough. Is it chesty? Can he complete sentences? Does he lose any consciousness? Anyone tested his oxygen saturations in the blood? Ask about the previous exposure to triggers like exercise, cold, upper respiratory tract infections, drugs, pets, and smoking, or contact to COVID patient. If known case of asthma, how frequent are the attacks? Last PEFR results. If recurrent, how many days with symptoms per week, or how many nights with the symptoms per month? Atopic march like runny nose, red eye, skin eczema, food allergy, and anaphylaxis. FWASL, fever, weight, activity, and sleep. These are we have to ask. Does he look like you and his daddy, and any other concern? So we need to explore the cough features and we need to know the level like what is mild, moderate, severe bronchial asthma from the present illness. Again, I am repeating the history of present illness. What we asked, started together or one by one. Onset, course and durations. What make it better and what make it worse. Then how it started. Is he turned blue? Is it more at night or the same all over the day? Describe for me his cough. Is it chesty? Can he complete sentences? Does he lose consciousness? Anyone tested his oxygen in the blood? So cough is chesty or not, complete sentences, lose consciousness, and anyone tested his oxygen in the blood. Then ask about the previous exposure to triggers like exercise, cold, upper respiratory tract infection, drugs, pets, smoking, or contact to the COVID patients. If known case of asthma, how frequent are the attacks? Last PEFR results. If recurrent, how many days with the symptoms per week, and how many nights with the symptoms per month? Atopic march like runny nose, red eye, skin eczema, food allergy, and anaphylaxis. Fever, weight, activity, and sleep. FWASL. Does he look like you and his daddy? Any other concern? Then systemic review one by one. CVS awareness of the heartbeat, chest pain, exercise intolerance, fainting attacks, and blood pressure. CNS about the headache, unusual movement, fits, weakness, loss of consciousness. GIT about the poo, tummy pain, increased tummy size, GERD, throwing up, and yellow eye. MS scan, skin or joint pain, joint swelling, bone aches, skin spots. Is it itchy? What its extent? What did you do for that? Does itching interfere with the sleep? Is there redness? Any hyper or hypopigmented areas in the neck and axilla? Change in the hair and its distributions, nails. Endocrine or blood sugar measured, symptoms of the steroid toxicity in chronic cases. So, steroid toxicity features like excessive hair, pigmentations, obese, weight gain, this we need to search. Urinary about the change in the pee color, amount and frequency, pain during peeing, hematology, pallor, bleeding and recurrent bugs. Past 65T, IOA, trauma, traveling, blood transfusions, any admission, investigation, examination, finding, these are. So in the chronic patient, if it is a known case of asthma, so when he diagnosed, who diagnosed him, how was the diagnosed, what treatment given to him, is he taking it regularly, who gives the treatment to him, any complications to the treatment, do you or he know how to use the inhaler or spacer, did you or he sit with the asthma nurse regarding how to use the inhaler, how many times per day, follow-up visits, speak flow diary if he has, is he wearing bracelets, blue or orange inhaler, so which color inhaler taking. So again, when diagnosed, who diagnosed him, how was the diagnosed, what treatment given to him, is he taking it regularly, who given the treatment to him, any complication to the treatment, do you know how to use the inhaler or spacer, did you he sit with the asthma nurse regarding how to use the inhaler, how many times per day, follow up visits, speak flow diary if he has, is he wearing bracelet, blue or orange inhaler. Then team follow with admission, operation and travel. Then we are going to perinatal as usual, puberty if relevant. So if the child is on puberty age, we asked, Nutrition, if breastfeed or formula, type of formula, when started weaning. Allergy, very important, ask about the other allergens in details. Vaccination, missing any shots, any extra shots and annual shots. Development plus growth chart, if obesity, suspect steroid toxicity in chronic cases. Family history of similar conditions, other allergies in the family, the sibling condition, consanguinity, who take care of the sibling in case of admission. Home, pets at home, garden, smoking, laminated floors, old painting, old pipes, aerations, changing the bed sheets and carpets, to which degree they wash it. Again, in home, very important these lines. Is there any pet in home? What about any garden? Anyone smoke in the home? The floor is laminated or not? What is the washing level? Is there any old painting, old pipes? Okay, aerations, the room is well aerated or not? Changing the bed sheets and carpets, to which degree they wash it. So you ask regularly, are you washing or not? Social, what did you do for a living? Is it satisfactory for the family? Any insurance or social support? Psychological impact of the condition on the child and the family, and social, scholar type, attendance and performance. What is the DD of wheezy chest or DD of exacerbation? So it can be first case of asthma, you can tell, or chronic case of asthma with exacerbation. The cause we can tell, like non-compliance to the treatment. When we take the history, we can find non-compliance to the treatment, wrong technique, taking inhaler, inappropriate dose he is taking, and triggers are still there, wrong diagnosis, other type of allergies existed. So this is all about how can we take the bronchial asthma history. Thank you.